we should start now because it's already 8:05,
Yes, yes.
8:10.
Yeah,
Okay,
yeah,
we will
yeah,
start.
yeah. Has the
Okay.
president and secretary joined? Dr. Fadnis sir?
उज्ज्वलाने फोन केलाय का?
केलाय. थांब मी बोलतेय.
नाही, पण त्यांना जॉईन झाल्याशिवाय वेलकम करावं
Yes,
लागेल.
I have joined.
नो, नॉट यू. डॉक्टर
सचिन,
पिंगळे सर आणि पाटे सर.
पिंगळे सर.
मॅडम डॉक्टर सचिन फडणीस जॉईन झालेले.
नाही, डॉक्टर फडणीस सरांबद्दल नाही बोलत आहे. डॉक्टर पिंगळे सर आणि डॉक्टर पाटे सर.
ते अजून ते नाही आले.
We are live now. Ajay?
Yes, madam.
फोन करा मॅडम.
Good evening, Kute sir, and welcome. Dr. Kute sir, our president-elect has joined us.
Welcome, Dr. Kute sir. Namaskar.
ज्योती मॅडम.
Yes, sir. Londe sir,
फोन करा.
welcome.
सर धन्यवाद, नमस्कार. सरांना फोन करून त्यांना अलाव केलं तर सुरू करा मग बघा.
रेणू,
हा,
पाटे सर जॉईन होत आहेत.
बरं बरं, ठीक आहे.
उज्ज्वला पिंगळे सरांचा फोन झाला.
चालू आहे. रिंग चालली आहे, बोलते त्यांना.
ओके.
सर गुड इव्हनिंग. मीटिंग जॉईन करा. रेणू,
येस,
पिंगळे सर जॉईन होत आहेत.
येस.
दोघांशी बोलणं झालं.
As soon as the board join, I will start. Please
Yes.
let me know. Ajay, do you have the flyer of our today's program?
Hello.
डॉक्टर
Good
पिंगळे सर
evening,
जॉईन झाले.
Pingle sir. Good evening and welcome.
वेलकम सर. गुड इव्हनिंग.
Good evening. Hello.
Dr. Pate sir has joined.
Okay, Renu, whenever he joins, we can welcome him there then. Whenever we come to know. So we can, I think we should
Can
start.
start. Yeah, we can start
Yes.
the program.
Yes.
Okay, no problem. Good evening, namaskar. I am Dr. Renu Boralkar, chairperson of Mission Pink Hill, Aurangabad IMA branch. So it gives me an immense pleasure to welcome you all on this platform today. I take this opportunity to welcome all the dignitaries on and off the dais, office bearers, all seniors, colleagues, and team members who have joined today for this webinar. Today, on the occasion of World Menstrual Health Day 2022, each year on May 28, the world comes together to celebrate this Menstrual Hygiene Day to create the awareness about menstruation, provide safe and hygienic practices to girls, and eradicate persisting taboos and stigma. Even in this 21st century, several women and young girls do not have access to proper menstrual knowledge and menstrual hygiene infrastructure, including sanitary napkins, clean toilets, or even safe disposal of the napkins. As a fertility cycle lasts for 28 days, the date chosen to mark this today's day is 28. In the same way, as the average period lasts for 5 days, therefore May, the 5th month of the year, is selected. So it is celebrated on 28th May, the World Menstrual Hygiene Day. This year's theme is World Menstrual Hygiene Day is making menstruation a normal fact of life by 2030. Maharashtra, Mission Pink Health and IMA have decided to celebrate this in the form of Teen Care Series. The first episode of this Teen Care Series was awarded to host by Aurangabad Mission Pink Health and IMA. So we thank you for giving us this privilege, Maharashtra State IMA and Mission Pink Health. I now take the opportunity to welcome our President IMA Maharashtra State, Dr. Suhas Pingle sir, and I request him to address this August gathering. Over to you, sir.
Yeah. Good evening, everybody, and I welcome you all for this very important symposium. The importance of today's topic cannot be stressed too much. As Gandhiji has said, you have to think of the last person, have-nots. So this will go a long way in helping the teenagers. So I wish all the best to this program and thank you very much.
Thank you so much, sir, for your blessings. Now I call upon Dr. Mangesh Pate, sir, Honorary Secretary, IMA Maharashtra State, to guide us. I think he has not joined. He's there. Sir, please unmute yourself.
Yeah, am I audible?
Yes, sir. Yes, sir. You are visible and audible. Yes.
Good evening, Honorable President of Maharashtra State, IMA, Dr. Suhas Pingle sir, President-elect, Honorable Dr. Ravindra Pute sir, all distinguished colleagues from IMA Maharashtra State, and all my IMA sisters and brothers across the state, and specifically from the Aurangabad. Now, this is a extremely nice scientific and academic event today being celebrated by MPH Aurangabad, and the event is on the day when we are celebrating the World Menstrual Hygiene Day. Now, as I understand this event, I can see participants mainly doctors, but as a Indian Medical Association, it will be my humble request that we should take up this event at the public awareness level. So IMA can play a big role as far as this very topic is concerned. And definitely it has been a history that IMA has played very important public awareness this thing at various times. Even during COVID times, it was only Indian Medical Association which played this very important role. So it is my humble request to Indian Medical Association MPH team that you go ahead with this public awareness program, and it should be regular at various places. So it will circulate the message from IMA, and it will also give image what we always say, that IMA is for people. So I congratulate the MPH Aurangabad, all office bearers, and thank you on the behalf of IMA Maharashtra State, on the behalf of our President sir and President-elect sir, that you invited us. Thank you. All the best.
Thank you, Pate sir, and also we will consider, and we are considering it, but presently the vacations are going on in schools and colleges, so we are doing with Dr. Chidgupkar madam's advice in month of June, when the school and colleges will start, sir, in the social era. Now I call upon our Mission Pink Health Chairperson of Maharashtra State, Dr. Jyoti Chidgupkar madam, to enlighten us about this Teen Care series, as she is the state organizer of this series. Over to you, ma'am.
Yeah, thank you very much, Renu. Good evening, one and all. to create a world where no woman or girl is held back because they menstruate. Respected President, Sir Dr. Suhas Pinge, Honorary Secretary Dr. Mangesh Pate, Sir, President-elect Dr. Kute, Sir, past President Dr. Londe, Sir, office bearers and leaders of IMA Maharashtra State, office bearers and leaders of Team Mission Pink Health, IMA Maharashtra State, office bearers of IMA Aurangabad, President Dr. Sachin Fadnis, Secretary Dr. Ujjwala Daipale, office bearers of Mission Pink Health, IMA Aurangabad, Dr. Renu, Chairperson, Dr. Vaishali, Dr. Aparna, Dr. Archana, Bandekar, Convener, Mission Pink Health, IMA, all eminent speakers of today's webinar, Dr. Nishi, Dr. Ritu, Dr. Vaijayanti, Dr. Jayasri, and all esteemed attendees of this very precious webinar. Good evening to all. At the outset, I would like to offer my very pleasant welcome to you all. We all are here to bring a very positive change in the life of girls. On behalf of Mission Pink Health, I am congratulate IMA Aurangabad branch and Mission Pink Health Wing for this initiative to start the Teen Care series for the doctors to top up the knowledge about adolescent health on this very special day. Let's get inspired to support our teen patients, friends, relatives, and adolescents around us for their better future. MPH is thankful to IMA Aurangabad and all speakers, and also grateful to IMA State President, Secretary, and all office bearers. Thank you, and let's begin for bright tomorrow. Thank you very much, Renu. Over to you. Renu, if you could, you can ask Dr. Kute and Dr. Londe sir also give their input.
Okay, ma'am. I now request Dr. Kute sir to please unmute himself and give us some blessings. Dr. Kute sir, are you there? Dr. Londe sir.
हॅलो.
Yes, sir.
सर्वांना आजच्या कार्यक्रमासाठी हार्दिक हार्दिक शुभेच्छा. मी तुमचा जास्त वेळ घेत नाही आणि गोकर मॅडमच्या लिडरशिप खाली चांगले कार्यक्रम होत आहेत. परत सर्वांना हार्दिक हार्दिक शुभेच्छा. ऑर्टो मॅडम.
धन्यवाद सर, धन्यवाद. आभारी आहे तुमचे. नाउ आय रिक्वेस्ट आवर ओन प्रेसिडेंट ऑफ IMA औरंगाबाद डॉक्टर सचिन फडणीस टू एक्सप्रेस हिज व्यू. डॉक्टर सचिन, या प्लीज अनम्यूट.
फोन बघा, मी पलंगावर ठेवलेला, काय झालं
Yes, Dr. Sachin, we are not hearing you.
Yes,
थोड़ा जोरात बोला, जोरात बोला.
Am I audible?
Yes, yes.
Yes, all the best for this online program by Mission Pink Health. Thank you.
Thank you so much, sir.
Thank you, sir.
I now request our dynamic honorary secretary, Dr. Ujjwala Daipale, madam, to share her thoughts with us.
Good evening, Dr. Suhas Pinge, sir, President Maharashtra IMA, Dr. Mangesh Pate, Secretary Maharashtra IMA, Dr. Jyoti Chidgupkar, he is a Mission Pink Health Maharashtra Chairperson, Dr. Sachin Fadnis, President IMA Aurangabad, President-elect Dr. Kute sir, and President, past President Londe sir, and Dr. Archana Bandekar, she is the convener of this Mission Pink Health, Dr. Renu Boralkar, Chairman of Mission Pink Health Aurangabad branch, and all eminent speakers, dear friends, and my colleagues, basically, and all office bearers of Maharashtra State and Aurangabad branch. On occasion of World Menstrual Hygiene Day, Mission Pink Health has given a very good initiatives. And doctors who care for our adolescent girls, this is one of the and participants, we assure you, not only for the doctors, for common public, so many activities through Mission Pink Health and all IM branches. And I will not speak more on this. And all the best to all the speakers and organizers. Thank you for giving me opportunity to speak.
Thank you, Ujwala madam, so much. Now I request Dr. Archana Bhandekar, who is Secretary Mission Pink Health Maharashtra State. She will tell us about the Maharashtra Pink Health working Mission Pink Health work pattern and goals. Over to you, Archana. Archana, yes.
Hello. Good evening,
welcome.
everyone. Am I audible, everyone, please?
Yes.
Oh, a very warm welcome to everyone. My respected seniors, all the office bearers, respected Pingre sir, Mangesh Patil sir, Archana Patil ma'am, then Jyoti Chidgupkar ma'am, Dr. Sachin Fadnis, Dr. Ujwala, and the entire core group of Maharashtra State Mission Pink Health. We already are associated with you since the last 3 years. I have been working with Mission Pink Health. Here I am now to tell you about the aims and objectives of Mission Pink Health, the activities which we carry out. I will just talk in short, will not take much of your time. The first aim is to make adolescent age group anemia free, where we go on for the detection, prevention, and we carry out some camps, and then we try to find out whether the adolescent group is again suffering and we can help them out. The second main aim is again to improve the adolescent health by scientific update on physical, spiritual, emotional, psychosexual aspects of the adolescent phase. The third aim of Mission Pink will be the menstrual health hygiene awareness in adolescent age group. The fourth aim, which we are now doing at present, okay? Then the fourth will be to spread the importance of welcome girl child. Now, at this moment, most of the urban areas, there is an awareness, but this awareness has to be brought in the rural areas. The next aim is the importance of vaccination, especially for the CA cervix and the HPV vaccination.
Hello, Archana. Mr. Ajay, is Archana seen? I think she has been locked off. So we will, madam, please.
Am I audible? Am I audible again now?
Yes.
Now you are audible. Yes, please continue.
Yes. I'm so sorry. You see, now just two more aims have remained about the adolescent health in rural areas. For this we have to have a special project on Aao Gaon Chale, where whatever possible we can do, we rush to the rural areas and do our social work. And then the last is awareness about the important issues in the adolescent age group of especially the social media addiction and the other drug addictions and the other possible addictions. So these are in short about the aims and objectives of Mission Pink Health, and which we all try to carry out as the NGO, as it is one of the biggest NGO IMA. I would also like more and more people to be associated with Mission Pink Health. And thank you so much for giving me an opportunity to be amongst one of you. Thank you so much, Renu.
Yeah, thank you, Archana ma'am. Now, today's webinar, we will start with the first topic, which is by Dr. Neeti Soni. The topic is puberty and related issue. Dr. Neeti Soni is adolescent and obesity consultant at Soni Hospital, Aurangabad, working since last 20 years in practice. She is a postgraduate diploma in applied nutrition and dietetics from Symbiosis Pune. She is having a multiple experience in adolescent medicine, where she has conducted teachers training for dyslexia, slow learners, workshop conducted on menstrual health and hygiene awareness since last 2 to 3 years. Also conducted camps for cervical cancer vaccination for adolescent females, and conducted webinars on mind matters during COVID period and media use and abuse for IMA and IAP children, parents' children. She, other than this academic activity, she is very much into social activities. Like she's president and founder member of NGO Get Going Group, Women for Fun Fitness and Health since 2010. She is doing charity work for Ramakrishna Mission Ashram, and she is the first woman half marathoner from Marathwada region, and she is doing half marathon since last 15 years, and also pursuing life coaching certification course. Over to you, Neeti, for your talk. Welcome.
Thank you, Renu, for the warm introduction. Am I audible?
Yes.
Am I clear? Are my slides visible?
Yes.
Good evening. First, I would like to thank Mission Pink Health, Dr. Pingre sir, Dr. Pate sir, Dr. Jyoti Chidgupkar ma'am, Chairperson of MPH, Dr. Renu Boralkar, IMA Aurangabad President, Dr. Sachin Fadnis, and Secretary Dr. Ujjwala Devpure for giving me the opportunity to present the mind-boggling topic of puberty in front of all of you. There's some noise in the background. Noise in the background. To celebrate the World Menstrual Hygiene Day. Now coming directly to my topic, puberty. Renu?
Hello, yes, you are audible.
I think my slides are not, yeah, that's fine.
Yeah, they are moving.
Now coming to my topic, puberty, I'd like to cover definition of puberty, physiology of puberty and menstruation, various physical and somatic changes taking place during puberty, assessment of growth and development during puberty. Puberty is defined as a period of transition from childhood to adulthood that encompasses physiologic, somatic, and constitutional changes associated with further development of the internal and the external genitalia and secondary sex characteristics. In simple words, puberty is a phase of life when the secondary sexual characters appear and mature and the capacity of reproduction is attained. Puberty in girls usually begins around 9 to 13 years of age and gets completed around 16 to 19 years. Various changes take place in a teenager during this period. Namely, there is acceleration of the somatic growth, maturation of the primary sexual characteristics, appearance of secondary sexual characteristics, development of cognitive function, menstruation, and the girl attains the ability to reproduce. The physiology of puberty is very complex, and I have tried to simplify it as much as possible. The exact trigger for the onset of puberty is unknown, but there are 3 distinct changes that are seen to occur. The hypothalamus starts nocturnal pulsatile release of GnRH, that is the gonadotropin releasing hormone, during sleep. This GnRH acts on the anterior pituitary to release in a pulsatile fashion LH and FSH. These gonadotropins in turn act on the gonads, which in case of female is the ovary, leading to the secretion of estrogen and progesterone. Several factors are found to regulate the GnRH release from hypothalamus. There is an increased level of kisspeptine, a peptide found in the hypothalamus, which leads to the release of GnRH. Neurotransmitter glutamate found in the neurons and the leptin found in the adipose tissue have stimulatory effect on the GnRH release. And similarly, the another neurotransmitter, GABA, the sleep hormone melatonin, and the hunger hormone ghrelin found in the GIT has inhibitory effect on the GnRH release. This explains the early onset of puberty in obese girls and delayed puberty in the malnourished children. Other than these gonadal hormones, there is a large number of other hormones which come to play during puberty. Hence, it is called as pubertal orchestration of hormones. The adrenal gland produces androgen, which is involved in development of pubic hair, body odor, skin oiliness, axillary hair, and the sexual attraction. The next is the thyroid hormone, which has a permissive action on the maximum linear growth during this period. Insulin secretion is increased by 30% during puberty, but is also associated with a marked decrease in the insulin sensitivity. The growth hormones and the somatobedins IGF-1 and IGF-2 production is rapidly increased, leading to the increase in the growth velocity. Estrogen gives the girl a feminine structure as it leads to the development of the breast and the wider hips. In small proportion, estrogen enhances linear growth, but it greatly increases the rate of epiphyseal fusion, leading to gross slowdown of height after menarche. It also increases the fat mass in the body, leading to a curvier body structure. It stimulates the development of labia, vagina, uterus, and the ducts of the breast, as well as the proliferation of the endometrium in the uterus. Progesterone converts this proliferated endometrium into the secretory endometrium. FSH stimulates the development of primary ovarian follicle and also acts on the granulosa cell to increase the estrogen production. LH acts on the ovarian theca cells to produce androgen and the corpus luteum to synthesize progesterone. The mid-cycle surge of LH induces ovulation. Here we see a nice display of all the four hormones, the LH, the FSH, the estrogen and the progesterone working in wonderful synchrony to bring about a normal menstrual cycle. Menstrual cycle comprises of four stages: the menstrual phase, the follicular phase, the ovarian phase, and the luteal phase. Estrogen spike is seen in the first 14 days and the progesterone in the next 14 days. Around 14th day, the LH surge leads to the ovulation, and FSH spikes around 10th day and reaches baseline around the 17th day. Now that the physiology is done, we come to the presenting features of puberty. Development of primary sexual characters, that is, increase in the size of uterus, in the size of vagina, ovaries, and the fallopian tube takes place. The reproductive system is all prepared to release the mature egg, which is ready to be fertilized. Endometrium now starts getting ready to implant this fertilized ova so that girl can now reproduce. The first radiological sign seen during puberty is increase in the ratio of the uterine fundus to cervix. So the tubular uterus, which was initially there in the pre-pubertal days, now becomes a pear-shaped organ. The endometrial thickness, once it reaches 5 mm, itself suggests of imminent menarche. The secondary sexual characters, mainly the breast development, the axillary and the pubic hair, takes place during this period. Tanner has classified this in 5 stages. Stage 1, there is elevation of the breast papilla and thin villous hair is seen over mons pubis. In stage 2, breast verts can be palpated. Below the enlarging areola and sparse hair are present along the labia. In stage 3, the breast tissue grows but does not have a definite contour, while coarse hair covers the pigmented pubis. In stage 4, there is projection of areola and the papilla, and the secondary mold formation takes place. Adult hair pattern is seen over the pubis. In stage 5, Breast gets the adult type contour along with the projection of papilla only. The pubic hair now spreads on the medial aspect of the thigh as well. Along with these changes, there are other cognitive, emotional, and social changes taking place during this adolescent period. The girl has an oily skin here and is now more prone to develop acne. The body gets a peculiar odor, more so because of increased perspiration. She starts getting conscious about herself. She has interest in opposite gender and starts getting sexual feelings. She thinks like an adult and starts looking for a personal identity. She spends more and more time with friends, and the peer influence is of great importance. She considers the consequences of the action that she is taking. She becomes emotionally oversensitive, and there are lots of mood swings seen. Along with these changes, puberty starts with the change in the hormone first, and then it is followed by the physical changes in the girl. The first sign that the girl is now maturing into the adult is the thelarchy, that is the development of the breast. It takes approximately 1.5 to 2 years for the girl to have menses after the breast births are seen. Thelarchy is followed by pubarchy, which means the development of the axillary and the pubic hair. This is followed by rapid increase in the height, which is the peak height velocity. At this time, the girls are taller than the boys in their class. Following this rapid linear increase, the girl starts menstruating. It is important to remember that in the first 2 years, the menstrual cycles may be irregular and may at times be anovulatory, and this is perfectly normal. It is only later that the regular ovulatory cycles start. Given here is the normal range when the different types of events happen in the girls. But it is very important to note that the failure of menstruation to start by 16 years in presence of secondary sexual characters, or if there is no appearance of the secondary sexual characters by the age of 14 years, then it is mandatory that the parents consult their doctor and seek further advice. Delayed puberty, precocious puberty, irregular periods, then premenstrual syndrome, dysmenorrhea, menorrhagia, polycystic ovarian disease. These are the various pubertal disorders and the menstrual health problems. These will be dealt in greater details in the coming talks. Similarly, love affair issues, behavior problem, anger, aggression, violence, bullying, substance abuse, depression and suicidal problems, nutritional disorders like anorexia nervosa, bulimia, obesity, internet addiction, these are all the mental health problems which are rampant during puberty. As we all know that puberty is the second period of rapid growth in the girl's life, hence it is utmost important to chart her height, weight and the BMI on a 6-monthly basis on the growth charts developed by the Indian Academy of Pediatrics. A girl normally gains 9 centimeters of height every year since the start of puberty, making it approximately 20% of adult height. Similarly, the pubertal weight gain accounts for about 50% of adult body weight. Along with this, the Tanner staging will tell us about the stages of sexual maturation. As discussed earlier, Tanner has divided this in 5 stages, starting from the prepubertal up to the adult pattern. By charting this, we know that during the SMR2 and 3, peak height velocity happens, and usually SMR3 menarche is attained. Knowing this, we can give anticipatory guidance to the girl regarding the physiology of menstruation and menstrual hygiene. It is important to tell this girl that periods are a natural part of growing up and there is nothing to be feared or to be ashamed about. She should have a positive conversation about her menses with parents, doctor, teachers, or older siblings whenever she has doubts. It is also important on our part to remove all the myths and taboos regarding menstruation from her mind and make her a bold and a confident individual as she takes on her journey of puberty. Thank you.
Excellent, Neeti. You have been on time and your slides were so much good and excellent deliberation on such a vast topic in a short period of time. So thank you so much. And now over to Dr. Archana for further proceeding. She is the other moderator for this today's session for the next two talks. Archana madam, over to you.
Yes.
Renu, just let me interrupt.
Yeah.
With your kind permission, I'll welcome Dr. Neeta Biyani, our Secretary, Mission Pink Health, IMA Headquarters. Neeta, are you there? Neeta? She has joined.
Yeah, I had seen her joining. Dr. Ajay, can you make co-host to Dr. Neeta Biyani, ma'am? Ajay?
Just a moment.
Ajay is the digital team member, so he can find her out.
Ma'am, I'm not getting that by what name she is
Neeta
connected.
Biyani. Neeta Biyani.
Maybe Neeta must be the name.
No, I'm not getting any Neeta. There is only Neeti.
Okay, sorry to interrupt. We'll proceed. If she joins again, we'll ask.
Yeah, I've seen her joining because, Yes, over to you, Archana madam, for the further proceedings.
Yes. Now he has disabled my video, I think so. So please ask the host to make my video start.
Ajay, please start Archana madam's video from your end, whether it is stopped.
Yeah, she can start it.
Yes, now
you are visible.
Yes. Now I will speak something about Dr. Ritu Balani. I also know her as Premlata Kaurani, a very bright student. She's done MD OBGY from GMC Aurangabad. She has done BA in Values and Spirituality, which again makes her a very calm, a very serene personality, and still a very strong gynecologist there practicing at Ulhasnagar. She is a consultant at Astha Hospital, Ulhasnagar, at Fortis Hospital, Kalyan. She has presented numerous papers on PCOS at All India Institute of Medical Sciences, Delhi, and many regional conferences which were at Mumbai. So, and she is also a very good friend of mine. So I welcome Dr. Ritu Balani. Ritu, please share the screen with me.
Hello, everybody. Good evening. This is Dr. Ritu Balani, Premlata Kaurani from Aurangabad. I thank Mission Pink Health and NPH to allow me this opportunity with you all. औरंगाबाद का नाम सुनते ही बस मैका याद आ गया. And I initially said yes, मुझे तो join होना है. Coming to the topic of today, menstrual hygiene. Why is this important? Because during menses, the chances of infection are more. Why? Because bleeding is a good culture media for bacteria and fungi to grow. The cervical mucus plug is dislodged during this time. So the entire perineum, the vaginal area, the cervix is open up to the uterus, and so the chances of ascending infection are very high. Thirdly, the proper use of the products and proper disposal of the products is very important in order to avoid the infections. The infections may be in the form of the UTI or reproductive tract infections. So we can divide this menstrual hygiene and we can talk about it according to 4 P's. The first P will be the products which we use. Initially, in the earlier days, reusable cloth was used. No doubt it was a good thing because the waste was not generated. But the disadvantage was it has to be washed with soap and water every time and sun dried. So the problem was where to keep it, where to dry it, and how to again keep it to reuse in the next cycle. Then came the reusable pads, sanitary napkins. Again, the same issue because they were reusable, how to wash, how to clean, and how to sun dry. Nowadays, there are very nice sanitary pads, disposable sanitary pads, which are very thin, which have a good absorbing capacity, which are given in a proper polythene, very easy to carry in your bag. So the girls, the office goer girls can carry them in their purse. Nowadays, what Still another thing is available is tampons. These are the tampons. You have to just insert it in the vagina. These are available in the two forms, with applicator and without applicator. This one is without applicator. This is just to be inserted in the vagina. And when it is full around 3 to 4 hours, this is just to be removed and disposed of properly. We will discuss the disposal accordingly. The only disadvantage with this tampon is when we forget it and if it is left in the place, it leads to a very severe infection, which is known as toxic shock syndrome. Because of this, this was not used comfortably with the girls. Then came the menstrual cup. This is a menstrual cup, which is silicone made, inert material. This is available in 3 sizes, small, medium, and large. The younger girls will use the smaller one. The married girls who haven't given a vaginal birth will use a medium size. And the elderly girls who have delivered vaginally will use a larger size. This is easy to use. With a C pinch or S pinch, we can insert into the vagina, and when the finger is released, it gets nicely fixed around the cervix. The blood is collected in this cavity. When the flow is more during second and the third day, it is to be removed with this stem and the blood is to be drained. Then this is to be washed, dried, and again reinserted. After the 5 days of the use, this is to be washed nicely, boiled, or sterilized with the UV rays, put it in the box comfortably, and keep it for the next cycle. Advantage: no waste generation, no recurring expenditure, and very easy to use, very comfortable. It is only to be removed after 4 to 6 hours, or as and when you feel it has filled up. You can really feel it because you can feel heaviness in the vagina. Second P is palms and perineum. Palms is hand and perineum. Important thing is washing. Washing of hands before urination, after motion, and before changing of pads with soap and water. And perineum is to be washed every time after urination, after motion, and after changing the pads. The perineum is to be washed from front to back, not from back to front, because this will lead to the anal infections right into the vagina. So the important point is it is to be washed from front to back. We can use normal soap and water, but hygiene washes are nowadays available, which regulate the pH around the perineum. Third P is paper. Paper means how do we dispose of these products which we are using. Why disposal is necessary? Because if left open, it will give a foul smelling, it will look ugly, it will attract flies and insects, and the transmission of infections like hepatitis B and C. There is no danger of HIV, however. So the disposable pads, these are to be wrapped into the paper bags or newspaper, and then they were thrown into the dustbin. Earlier days, in the rural areas, they were burying it in the pit or burning it. These are not to be thrown into the latrines, otherwise they will clog the flushing system. Fourth P is period in between the periods. This is very important to heal back, to come back to your normalcy. Because of the bleeding, some girls who have the excessive bleeding will become anemic. So the period in between the periods is very important for your nutrition. Today being the World Nutrition Day as well, these adolescent girls and the girls who are menstruating will have to take the balanced diet, which will be adequate in iron and folic acid, in order to build up their immunity and to be ready for your next cycle. I think I've covered all the points. Menstrual hygiene, this much is quite enough just to avoid infections. This is very important. Thank you so much. Thank you, team IMA and team Mission Pink Health.
Archana, madam?
Yes, again. Again, I'm being disabled. My video is being disabled. So thank you, Premlata, so much. Thank you, Dr. Ritu. It was a very simple and a very practical approach presentation. So we are so glad that you are with Mission Pink Health today for all of us. Thank you so much. So now I would request Dr. Vaijayanti Patwardhan ma'am. She is a multifaceted personality. We are glad to have you, ma'am, here. She is a consultant gynecologist and a public health researcher. She is presently working as a deputy lead for Maharashtra State Tuberculosis Cell Support. She is also a marriage and relationship counselor and very surprisingly, a short filmmaker. Madam, so glad to introduce you. She is a chairman, WDW IMA Maharashtra State, past president, Indian Medical Association Pune, member of Indian Medical Association Pune and Pune OBGY Society. She is the recipient of medical, literary and media awards. So, madam, I'm really very glad that you are with us today. So I request you to share our screen and please give your talk, ma'am.
Yeah. Thank you, Archana Madam, for the kind words of introduction. At the outset, I would like to thank the team of IMA. My special thanks to IMA Maharashtra State President, Dr. Suhas Pingle sir, Secretary, Dr. Mangesh Pate, the IPP, Dr. Londe, President-elect, Dr. Kute, Chairman, MPH, WD, Maharashtra State, Dr. Jyoti, and all the office bearers of IMA Aurangabad, namely Dr. Sachin Fadnis, President Sir, Dr. Ujjwala Daifale, Secretary, Dr. Renu Buralkar, who has been communicating with me very frequently, who is the chairman of MPH, Dr. Archana Bandekar, who is the convener of this program, and of course, all other office bearers and the audience, all delegate members. Thank you very much for making me a part of this very important, I would say, aspect of adolescence, and that is the menstrual hygiene and menstrual care. It's a very vast topic. The topic which has been given to me for the talk is the common menstrual problems in adolescence, and it's a huge topic. I'll try to cover in the given time, but then my request to the conveners, please, you can give me a hint about the time, because it's difficult to keep up to the time, especially when we have to speak about many things in a given particular time. So I'm sharing my screen. Is my screen slide seen to all? Hello?
Yes, madam.
Yes, ma'am. Yes.
Yes.
Sorry?
Yes.
Yeah, so we'll quickly discuss about the common menstrual problems in adolescents. 1 minute. So generally, what are the common reasons why adolescent girls present to either an OBGYN or any family physician or any other doctor who is in whom they have full faith? So they are mainly the menstrual disorders. The disorders can be divided as problems related to the flow, then painful menses and associated problems. Next is any abdominal pain or pelvic pain could be the presenting symptom. Then abdominal mass, of which ovarian masses are pretty common in adolescent girls also. Infection-like symptoms like vaginal discharge or urinary symptoms. Then cosmetic issues. Nowadays, as you know, PCOS, a condition like polycystic ovarian syndrome, are very common. Apart from that, many of the hormonal issues also, they get precipitated during this particular period. And that is why acne and hirsutism, this is a bothersome symptom for all ages, but more so in the adolescent period, because they suddenly start getting all these acne and some changes. And that is the period when they would like to look really beautiful and catch everybody's attention. Very beautifully explained explained by our first speaker, Dr. Niti. Apart from that, the mood swings, lot of stress adolescents bear through because this is a period of their career building, and that is why mood swings and mood related symptoms could be the cause, because many times the mother gets the daughter for all the fights which they keep on having in the house. So, and the last but not the least is contraception and sexually transmitted infections. The thing is, these days what we see is, premarital sex, as was told during my introduction. I'm running a counseling center. Earlier I used to call it marriage counseling center. Now we have labeled it as relationship counseling, because adolescents are very actively indulge into sexual activities, and that is why contraceptive advice is very, very important. So just a quick look, though Dr. Niti has beautifully demonstrated all the changes which occur at adolescent period. I'll take you through this only one slide just to understand that in a woman's life during her reproductive period, all things are occurring in a cyclical manner. So these type of cycles are happening in the inside the body of the adolescent, in which uterine endometrial cycle, as you see here, is starting from the onset of menses till the onset of next menses, in which the endometrial growth is seen up, which is in the first half of the cycle, which is called as a proliferative phase, and then there is a mid-cycle many changes which lead to ovulation, which is generally between the 14th to 16th day of a normally menstruating girl or a woman. After that, if there is no conception, then there are secretory changes in the endometrium. If there is pregnancy, the residual changes take place. Otherwise, the secretory endometrium at the end of the menstrual cycle, so hormone support is withdrawn, and that leads to the next onset of next menses in the form of bleeding. So this is what is the uterine endometrial cycle. Along with that, the ovary, which plays the very important role in regularization of all hormonal and other changes in during the reproductive life. So there are ovarian changes also. So there are multiple follicles which start developing at the end of the menstrual cycle, but only one becomes a dominant follicle. All others, they get degenerated, and this particular dominant follicle that releases an ovum, which is at the time of ovulation, which leaves the follicle into a corpus luteum, which is responsible for governing the second half of the cycle, because progesterone hormone is released from there. With respect to the hormonal changes, estrogen is the hormone which regulates the first half of the cycle predominantly. There is a surge in the peri-ovulation period time, and then the second half is governed by progesterone. And all these things are governed by anterior pituitary hormones, which are again under the influence of hypothalamus. So HPO axis shown we have seen in the first presentation is the main remote control of all events which occur inside the body of the adolescent and any woman during her reproductive life. So when we talk of menstrual problems, we need to understand what is normal menstruation, because the definition of normalcy in the common people changes from family to family and from person to person. So why we need to understand this is because very rightly told by ACOG committee is that menstruation in girls and adolescents should be considered as a vital sign, as we will be seeing in the further slides also. And as we understand that HPO axis is very important, which is related to the stresses and all the issues which are bothering the mind of the adolescent, leads to many disturbances in the menstrual cycle, and that could be the root cause of many of the menstrual problems. And that is why it should be considered as a vital sign, and it should be a part of history by any clinician, whoever is managing the patient. So generally, for first few months to maybe years, the cycle may be irregular, because that is all an anovulatory period of phase of the life. Sorry. So initial part of the menses is menstrual cycles could be 1 minute. Just going back. Yeah. So first 2 years after menarche could be irregular cycles, but 90% of the girls will have normal cycles within first year of after first year of menarche. The cycle length, though it is expected by common people to be exactly 28 days to 30 days, but the variation of 21 to 40 days is very important to understand, with a mean of 32.2 days. And that is why a girl who is getting regular cycles at the interval of 21 days or even 40 days would be normal for her body. The flow is generally 4 to 5 days on an average, but then 2 to 8 days is considered as normal. The interval between menarche and regular cycles is generally of about 14 months. So initial first year at least, the girls are bound to have irregular cycles with respect to the cyclicity as well as the flow. But if the cycles are persistently less than 28 days, 21 days or greater than 45 days, or any variation in the duration of flow is a cause of concern for the physician also. And we need to investigate what are the, if there is any underlying cause for that. So let's understand few of the definitions. Menorrhagia, when we call menorrhagia, it means that excessive uterine bleeding or prolonged uterine bleeding. So excessive means more than 80 ml. On an average, 30 to 50 ml is the blood loss, which is supposed to be normal. And prolonged, if the cycles get, the bleeding is continues beyond 7 days, it is considered as menorrhagia. DUB is any abnormal bleeding for which there is no organic cause. Oligomenorrhea, uterine bleeding occurring at infrequently, that is at the interval of 35 days and 6 months. Amenorrhea means absence of menstruation for 6 months or more, and dysmenorrhea refers to painful menses. Other abnormal conditions which are metrorrhagia, menometrorrhagia, polymenorrhea are not that common. Let's understand how ovulation influences the normalcy of menstruation or relates to related problems. So initially, as I said, there are anovulatory cycles. Generally, it leads to irregular menstrual cycles with oligomenorrhea, amenorrhea. At times, even menorrhagia can be because of anovulation. Ovulatory cycles, they have regular menstrual cycles, but with dysmenorrhea, menorrhagia, premenstrual syndrome, and mastalgia. Why is this important? It is important for managing the patient. If the girl is having ovulatory cycles, then suppressing that ovulation could lead to solving her problems, and that is where we need to give her combined hormones or combined OC pills. But if it is an ovulatory cycle, that means the ovulation has not taken place, and that is why progesterone is the problematic. I mean, there is a deficiency of progesterone, and there the progesterone supplementations are the drug of choice. So we need to understand the cyclical nature of the symptoms. So let's see the commonest condition where the patient presents to us. Dysmenorrhea means painful menses. It could be primary or secondary. I'm not going to the details of the definitions or any scientific aspects. So primary typical presentation would be with backache, lower abdominal pain, which will never extend beyond the knees. Okay, so anterior thighs, inner thighs, then lightheadedness, lower abdominal pain, muscle cramps. This is what is the typical presentation. This is primary dysmenorrhea for which there is no cause, and that is why typically the symptoms will occur few hours to maybe a day prior to menses, and they get relieved as the menstrual flow starts, which is generally 24 hours. But secondary amenorrhea could be because of the various conditions like cervical stenosis, endometriosis, ovarian cyst, etc., and there the pain continues, and that is why there may not be relief with onset of menses. So what is the treatment of dysmenorrhea? This is a very common concern. See, in my practice, commonest medicine is mefenamic acid, though other analgesics like ibuprofen, ketoprofen, naproxen, etc. are recommended. Mefenamic acid, 500 milligrams, 6 to 8 hourly is the recommended dose. Now, of course, not indicated if the girl is an asthmatic. Many a times we get the question from the parents whether it will lead to any habit formation. But if the dysmenorrhea is disturbing her day-to-day work, then it's worth giving the tablets for a day, and so that her day-to-day work does not get affected. Here, counseling plays a very important role. We all have learned a sentence that a dysmenoric mother always has a dysmenoric daughter. That means what? It's partly psychological. There's no measure to measure the pain factor, right? We don't have any gadget to measure the intensity of pain. And that is why counseling plays a very important role, apart from general supportive treatment like taking a walk in a fresh air, or having warm water bath, or some such things, heat fomentation and all. So these things also work. So if it is secondary dysmenorrhea, we need to treat the cause. Next is menorrhagia, which is another common condition in adolescent period. Definition is heavy vaginal bleeding that is not DUB. That means with or without prolongation. Generally, it is secondary to hormonal imbalance, which is extremely common in women throughout their reproductive life. These are some of the times like puberty and adolescence, where hormonal disturbances or imbalance is very commonly seen. Apart from that, the postpartum period and perimenopausal period also, women tend to get this. Then tumors, other causes like tumors or distortion of uterine cavity, these are also important causes for menorrhagia. Here, the basic pathophysiology is that uterus is unable to contract down on open venous sinuses in the zona basalis, and that leads to excessive menstrual flow. The common causes I just mentioned, it is important because it disturbs the day-to-day schedule, and if excessive and prolonged, it can lead to severe anemia, which is again a global problem, especially in India, up to the tune of 65 to 70% in the adolescent period. So the underlying cause needs to be evaluated. And as I've shown in this, there are various causes. I won't go into all these details, but we need to understand that few tumors, few hormonal changes are the commonest causes. But then, as I've shown here, the spontaneous abortion. Girls are indulged into sexual activity and contraception. If it is not practiced, these days they know the abortion pills also. So somewhere they take the pills and may present to us with excessive bleeding, which is actually bleeding due to incomplete or spontaneous abortion. One more condition is sexual abuse, again very commonly seen in today's society, and we need to keep these two causes also in mind when we are taking the history of the patient. Non-gynec causes like von Willebrand disease and coagulation disorders, and Dr. Niti has shown us how the thyroid and other hormonal changes occur at this period. So all of them can lead, this abnormal uterine bleeding can be a symptom of any of these conditions. So it is almost all in the history. If we spend little more time in taking history, because in adolescent periods generally we will not go ahead with a per vaginal examination, right? So it's all in the history, and we need to spend enough time to understand the menstrual history, how frequently, how long. Whenever a patient says how much that she's suffering from excessive bleeding, we have to ask her the details about whether it is associated with passage of clots, and whether it is how many pads she changes in a day. So in a day, if she's changing 2 to 3 pads, and if it is not with cloths, then maybe the bleeding is not excessive, though her perception could be that. Then we need to do a focus physical examination in which vital signs, the skin examination for pallor is very important. Neck for thyroid, breast for Tanner staging is important. We have learned in the first presentation. Abdomen for any palpable mass. External genital examination. As I told you, sexual abuse, there could be a vaginal tear or urethral tear, which leads to excessive bleeding. So all these causes must be ruled out by external examination only. Some lab tests could be recommended if the history is repeated of menorrhagia, like CBC, doing prothrombin time, pregnancy test. I've told you the importance, and other, in case the symptoms keep on recurring, then we need to investigate for a second tier lab investigations also. I won't go into detail. Now, the ultrasound, I will definitely recommend spend 1 minute here. Ultrasound is very, very important because, as I said, we are not going to perform any per vaginal examination unless we suspect something, and there may be examination under anesthesia may have to be performed. But ultrasound is the arc of gynecologist, and that is why ultrasound will give us information about the endometrial thickness, which is a crucial point in managing menorrhagia. So endometrial thickness, if you are referring a patient for pelvic sonography, please mention, ask the radiologist to give you, the sonologist to give you the endometrial thickness. If there are the secretory endometrium, you see a thickness which is more, they respond the best with progestogen supplements. Okay, so that is why it is very important. It will also give an idea about Mullerian anomalies, which are at times diagnosed for the first time during adolescent period. Other things like leiomyoma and teomas and ovarian tumors and all, everything will be revealed by that. So how do we manage menorrhagia? And a commonest thing will be antifibrinolytics and hemostatics like ethamsalate and tranexamic acid. Ayurvedic medications are also there, but I will not recommend these. But I mean, it is individual discretion, though as allopathic doctor, we are not supposed to write these preparations. And I'm aware of how the Ayurvedic products are bombarded during our clinical practice. Okay, so basically it is ethamsalate and tranexamic acid along with maybe mefenamic acid, which also helps in contracting the muscles of uterus, and that helps in reducing the blood loss. Hormone therapy, that is a medical curettage, okay, which is very effective in adolescent periods. And as I said, progestogens are real friends of a gynecologist and the adolescent girls with least side effect. The moment we utter hormones, the mother is going to ask us whether it will have any side effects. So we can rest assure her that progesterones have minimum side effects, and they will induce the secretory changes, which will reduce the blood loss at all ages during the reproductive life, but very important during the reproductive, the adolescent period. Synthetic estrogens like ethinyl estradiol or low dose combinations of estrogen and progesterone derivatives. Danazol, androgen, and other androgenic side effects they do have, and that is why we have to first rule out the diagnosis. If it is a condition like endometriosis, then we need to put them on higher medications and hormones also. Apart from that, the general supportive treatment like iron, calcium, vitamin C, nutritional advice are very important, and treat the cause. If there is coagulation defect, of course, we need to take the help of the hematologist also in that case, and we have to manage the patient jointly. Counseling to the patient, parents, and family are very, very important. Do I have time? Because I had put the alarm of 12 minutes. So should I continue? There are 2-3 conditions.
Yeah, ma'am. Please continue. 5 to 7 minutes here.
Maybe 5 minutes. I'll try.
Yeah, sure, ma'am.
Yeah. So this is one important condition. Why have I included this slide is endometriosis. Now, this is one condition which can never be diagnosed from outside, for at any age. So endometriosis could be as common as 70% of adolescents who do not respond to our medical treatment. Okay, so that true incidence is actually not known, and if we put the patient for laparoscopy and all, then only we will be able to diagnose endometriosis. But then if the girl is not responding to the routine treatment which I just mentioned, we have to keep this as in our mind as underlying cause. Next, we go to the amenorrhea. I remember spending maybe weeks on understanding amenorrhea during my MD post-graduation, and amenorrhea is not at all a simple thing to understand, though simple to manage at times, okay? But theoretical part is really, it's very complicated. So if there is primary amenorrhea, the girl never starts menstruating. Okay, this is the situation. As we know, the age of puberty is advanced these days, and girls are getting puberty by the age of 10.5 years also, at times even 8 years onwards. So if there are secondary sex character in a earlier age, the woman, the mother should be counseled to instruct the daughter, that likelihood of menses is there, and nowadays the schools are taking up all these programs. So if there is absence of menses by the age of 14 years with absence of secondary sexual character, we label it as primary amenorrhea. Or absence of menses with normal secondary sexual character at the till the age of 16, again it will be labeled as primary amenorrhea. And the reasons are, I mean, these are not very common conditions. There are vaginal agenesis, some Mullerian abnormalities, or androgen insensitivity syndrome, Turner syndrome. These could be the conditions, though not very common. So primary amenorrhea, we need to again have a joint management. It needs a thorough workup. But if it is secondary amenorrhea, that means the menses, the girl was menstruating and now she's presented with secondary amenorrhea. The commonest condition would be pregnancy. Okay, the girls will never declare to the managing physician, especially in front of her parents, and there we need to take her into confidence and maybe give her the privacy to disclose the things, and we have to tell her that we have to do a urine pregnancy test at least, so that we can rule out the pregnancy, and that should be the first test which I will advise. Apart from that, the hypothalamic induced like weight loss, as I said, the girls are very particular about weight, and if there is, with the pubertal changes, when there is some deposition of fat, the weight gain is bound to be there, so it will lead to a lot of eating disorders and exercises, stress. So that is also one common reason of secondary amenorrhea. Apart from that, polycystic ovarian syndrome, which is again 25 to 30 patients of the OPD of a gynecologist, thyroid disorder, pituitary disorder, and any chronic illness, including tuberculosis. Okay, they are the causes for amenorrhea. There again, we need to do a thorough investigations about all these hormone assessment, sonography, and many more things, and then manage the cause. And then the girl, we can start with a progesterone withdrawal bleeding if all other investigations are normal, and then we can give combined oral pills or ethinyl estradiol followed by progesterone, so that the girl start and see whether the girl gets withdrawal. Next, we come to another common condition in the younger age group, and that is polycystic ovarian syndrome. So clinical symptoms and signs are generally they present with amenorrhea or hypomenorrhea, that means less menses and irregular menses, along with weight gain. Hirsutism, that means some virilization signs of variable degrees will be, and maybe that is the first symptom for which they will present to a doctor. Insulin resistance is a part of this syndrome, and there the diagnosis, for diagnosis we need to do ultrasound. As I told you, it's always the first investigation for all my patients, wherein you will see the ovarian volume is increased. Okay, that is why you must ask the sonologist to give you ovarian volume. That is what matters a lot. So typically polycystic appearance means what? Multiple small cysts which are peripherally placed with an enlarged ovary. This is the appearance, and there is no dominant follicle. It is an anovulatory type of a condition. The hormones, the disturbances because of that. Apart from that, then we proceed with LH, FSH, prolactin, serum, free insulin, testosterone. These would be the workup for PCOS. Now, when it comes to management of PCOS, again, progesterone, our friend, or combined hormones are the drugs which are given to manage our menstrual complaints. Spironolactone plays very important role. Metformin, which is an insulin sensitizer, so that is also another drug which is required for this thing. For her cosmetic symptoms, we advise electrolysis and thermolysis. Main thing is lifestyle modification for in the management of PCOS. So obesity management is very important. Generally, the blame is put on the weight, but it is the other way. It is the obesity which leads to polycystic ovarian disease and hypomenorrhea. So we have to counsel her for diet, exercise, stress management, and all other aspects which are important for getting her to the ideal BMI at that particular age. Last, I think this would be one of the last slides. It is premenstrual syndrome. We have to take a note, very important note of it. And I will assure you that why it is important is because premenstrual syndrome has led to many of the social disasters also. If you ask any husband, he will say that my wife, it's horrible. And most of the time the husband would like to spend in outside with his friends, especially in the premenstrual period, because the wife will keep on fighting. there have been studies conducted abroad where they have found that in the premenstrual phase, the tendency to accidents, the tendency to homicides also increases in women, and so is what happens in the adolescent period also. So premenstrual syndrome is something which we have to understand rather than just criticizing. Very commonly seen again in the younger women, and during adolescent period. The typical signs and symptoms are physical as well as psychological. They occur in the week prior to menstruation, and they are relieved generally with the onset of menses to recur in the next month around the same time. It disturbs the girl socially and her personal life also. The diagnosis is generally clinical, and by noticing the cyclicity, the cyclical occurrence of symptoms with repetitive nature of complaints leads to the diagnosis. There is not no need of carrying out very hi-fi investigations for that. So what are the typical symptoms? The symptoms could be emotional, like violence, suicide, as I told you, anger, anxiety, excessive crying, depression, fights with the parents, the mood swings. Apart from that, with the physical features like acne, anorexia, bloating. Then other symptoms which disturb the girl are breast tenderness, swelling. They feel bloated. That feeling is there. Edema, facial puffiness, fatigue, headache, all these symptoms are seen. So the diagnosis is mainly by the history, by keeping the menstrual calendar and watching the cyclical nature of the symptoms. And for management, it is general supportive treatment. We need to do thorough counseling of this patient, that it is a known condition. We have to give her moral and social support by counseling her parents and the family also. Lifestyle modification, yes, if she indulges into a regular positive activities which will reduce her stress, they help a lot. Pyridoxine is a drug of choice, and long-acting, long dose of sustained release pyridoxine tablets. They are given throughout the month for at least 3 months. Hormone support she may require. This is again a condition which has a correlation with the ovulation, and that is why at times we may have to put her on OC pills. So girls and beautiful ladies, we all want our daughters and our patients to see happily enjoying their lives and all enjoying, manage their stresses and overall life like this. And I hope I could throw some light on the common conditions and common presentations in our day-to-day practice. So once again, I thank the organizers for giving me the opportunity. Thank you.
Archana ma'am. Thank you, Dr. Vaijayanti Patwardhan ma'am, for such a lucid presentation of a very vast topic. We know that it was a short time given to you all, but the webinar was meant for a 1 hour session. So I'm sorry for
the time.
But still, yes, you covered all the things for the adolescent girls. So extremely thankful for your presentation. Now we now move to the next and the last topic of this session, which is by Dr. Jayashree Shivalkar from Nagpur. Her topic is psychosocial effects related to early puberty. Dr. Jayashree Shivalkar is a developmental pediatrician and she a child and adolescent psychologist at Child Development and Activity Center Nagpur. She is a national level life skill trainer and has written various articles on child development. She is an ex-member of State Advisory Board on Disability, Maharashtra State. She is ex-president Adolescent Health Academy Nagpur and also conducted more than 100 workshops for parents, teachers, students and rehabilitation and professionals. She is presently a member of State Committee Mental Health Board. So over to you, Dr. Jayashree ma'am, for your talk.
Yeah. Good evening, everybody. Good evening, everybody.
Good evening, ma'am.
And yeah, and thank you, organizing team, for having me here in this important session. And the topic given to me is menarche, its impact and issues. Here we are considering the early menarche. So a very typical case is a 9-year-old girl who is obese and history suggestive of recent onset periods. And whenever we get a case of early puberty, we all know that we go ahead with a detailed history, examination, investigation, and all the whether it is constitutional or whether some etiology is there. But the missing part many times is the psychological intervention associated with early menarche as well as with routine menarche. So this is what we are going to see. What are the issues which we need to consider or handle when we have a child or adolescent, not adolescent, when we are talking about early puberty. So here the main important is to guide the parents regarding the emotional, psychological, and social skills which are not matching with the hormonal surge. So whenever the child is developing into adolescence, we all know that it is a complete range of development with emotional, physical, mental, psychological, socials. Along with this, there is a simultaneous hormonal development leading to reproductive readiness. But here in the child, these emotional, psychological, social skills do not match with the hormonal surge or whatever changes are which are occurring in the body, and that leads to lot of problems for the child as well as for the mother to handle her. So handling of period itself needs extra training. It needs attention and the support from the mother. And many times mother herself is so anxious because you can imagine she's just a child and she's getting her periods, and that leads to anxiety to mother, and she is sometimes irritable, sometimes frustrated, and may not be able to give that much of support. So parent needs to be guided on that aspect also. Then along with the puberty, along with the menarche, we know there are body changes which are occurring, the vaginal discharge, the typical body odor, and this all can be disturbing to the child. And the school absenteeism and the emergencies because of the periods which the child may not be able to handle. So these body changes and vaginal discharge, again, parent need extra training, extra counseling, and we have to tell the mother that this needs to be handled, and she needs to talk to the child about handling this. So the parent are definitely worried, and they should be made aware of the following things: that whenever there is early puberty, mental health issues are very common, and it is very rare that we handle those issues, or when we address these issues to parents, or even parents are not so much concerned because their whole mind is engrossed in the periods. So mental health issues are very common. Eating disorder can be associated, or can be cause and effect both. And as we all know, obesity is many times associated with early puberty. And there are disruptive behavioral pattern. If you give just 5 minutes to the mother and you talk to her, and she'll tell you how it is difficult to handle the child now that she is having her periods. Along with this, there could be psychosocial problems, and the most risky thing is early sexual behavior. As we know that there is no psychological maturity, there is no mental maturity to match the hormonal development, and the child is thinking about this, she is curious, and nowadays they have all the media in front of them, they can see whatever they want. And this girl, she would prefer to be with older girls, or she'll be interested in what parents or big adults are talking, and that can lead to early sexual behavior even before the mother could imagine that such thing can happen. And then of course she's facing the problem of teasing, bullying, and isolation in the school, because all other children are looking small, they are still playing their out sort of games and talking like a child like, and she is suddenly feeling like a grown up girl, and that can lead to these problems in the school. And of course we must never forget that she is an easy target for sexual abuse, because especially the elder males in the family or in the surrounding, they can easily offer her chocolate, or they can easily lure her into something, and she can be an easy target for sexual abuse. So these are some of the they should be parental concerns, and we have to make the parent aware of these things, Then only they will realize that these are the things I need to understand. So as we are handling the problems which are because of early puberty, at the same time we have to give them some insight about the long term problems also which a child or a person may face later on. And definitely we know that early height may be affected. There could be obesity, PCOD, or non-communicable disease. Probability is much more. Then there is increased risk of reproductive and breast cancer. As we are conducting awareness program for breast cancer, many times early puberty is given as a risk factor, and we definitely recommend early screening, maybe at the age of 30 also. So this is the time you can just mention to parent that she needs to go for early screening for this CA breast also. Then HPV infection, and as madam has suggested, teen pregnancy can be very common. She herself can indulge in such activity, or she can be abused also. And today also we see many young girls who are not even aware that they are pregnant, and such thing can happen in these issues also. And as I have already told, that mental health issues are very common in the uh, children or adolescent who had early puberty. So these are the issues we must enlighten the parents with. And just a slide about late menarche. Uh, as opposed with the early menarche, now we have a child who is 15 years, a tall, lanky girl, and no history suggestive of menarche. Definitely, we go ahead with the all evaluation and treatment, but at the same time, we have to address these issues. The parental concerns in late menarche are severe anxiety. See, having a period earlier is definitely a cause of concern, but at least there is a puberty. But here the child is 13, 14, 15 years and still not having periods. Definitely parents are more anxious. And here again the difference is that the adolescent is also aware of the problem. She knows that I'm not fitting in my peers. They are talking about periods, they are talking about sanitary napkins, their bodily changes are there, and she will definitely feel left out and isolated. And this can lead to a very negative self image and lead to interpersonal stress with the peers also and with the parents also. And these are the girls who will have a very low esteem. And so definitely here also parent needs a set of counseling to handle late pubertal challenges also. So the role of parent here is they have to manage their own anxieties, because to handle the child, parents should be confident enough. They should be aware what I'm going to face, what I'm already facing, and how to handle these things. Then she has to, parents need to take help and share their concerns freely. That whatever problems they are facing, they need to talk with the doctor, and doctor also need to give some separate time to handle this, share these concerns with the parent. Then how to talk with the child. So here we have to tell the parent that you be honest to the child, give a positive outlook, and it has to be a brief discussion and a factual discussion. And it has to be in tune with the cognitive level of the child. So you cannot talk whatever the child may not understand. So in case of early puberty, they have to be in tune with the cognitive level of the child. And we have to break the information into manageable chunks, maybe related with the handling of period, maybe related with the body changes, or maybe related with the early sexual exposure. So whatever, it has to be done in a small manageable chunks. So whenever there a child is anxious or worried, or she is trying to seek some more information, the parents need to understand that they have to respond to the emotional content of the question. Every time the child is not in search of scientific answers, but the child is anxious, basically stressed. So this is something which parents need to handle. They have to respond to the emotional content of the question. And in case of early puberty, as there is more sexual exposure or curiosity, parents today, nowadays especially, they have to deal with the some sexual queries and related with the LGBT, because many times they are they see on the TV, they see on the YouTube and all those they are exposed to social media, and they may ask these questions because of their curiosity. So parents need not get shocked, but they should be ready to answer these queries. and they have to seek counseling to handle the mental health issues. And as well, we have to sensitize the teachers, because school plays major role in child's life and other social contacts to deal with the issues sensitively. So this is just a child of with special needs. I just read it. So in a child with special needs, we have to anticipate and be ready. Start training, hands-on training before the expected time. Use pictures, models, stories to prepare beforehand. Focus on self-help skills. Teach safe and unsafe touch and abuse, and manage dysmenorrhea PMS. This is in case of special needs adolescent girls with puberty. So the take-home message is that early puberty or late puberty is a very sensitive issue, and parents as well need support in addition to the child. So management includes, apart from the medical or surgical management, include counseling, and definitely follow-up is essential. And special needs girls and their parents need early sensitization and training. So thank you. Thank you so much for giving me the opportunity.
Yeah, thank you, Dr. Jayashree ma'am. Excellent presentation. You have said the last slide, which is very, very important, that the parent themselves has to be tackling in a very sensitive manner with the child, as the child might get confused because of the early pubertal spurt that the child is having, and all the psychosocial aspect that the child she is going through. So thank you so much for the talk. If there are any questions, kindly put in the chat box. Till then, I will ask our state organizer, Dr. Chidgupkar ma'am, to give her expert comments.
Thank you, Dr. Renu. Thank you very much, all the speakers, for for delivering such an extraordinary and informative and very lucid speeches on this very sensitive issue of menstruation, menstrual hygiene, as well as psychological effects of menstruation, which is actually regarded as a taboo subject and has very odd and unwanted effects on girls' education, as well as health and well-being and safe pregnancy. So we have seen that many times when we visit school, there is a lot of dropouts because of just menses. Girls tell that our parents don't send to the school. Teacher also don't know how to manage such girls who are menstruating. So it's very much needed, as Dr. Jayashree said, that education of teachers and parents is also very necessary. Dr. Neeti has very nicely explained us about physiology and anatomy of puberty. Then Dr. Ritu about hygiene. Really, it is very important to avoid side effects of infection and other things, complicated pregnancy afterwards because of infection. So hygienic practices during menstruation is very important. Then Dr. Vaijayanti has very nicely elaborated us the problems during menstruation and about menstruation and about puberty. And of course, Dr. Jayashree has very nicely told us about psychological effects and psychological remedies for these problems during pregnancy. So I suggest, friends, we as doctors should uh, mm, come together to educate and increase awareness about very uh, physiological, or we can say it as a biological phenomena of girls' life, by educating parents, teachers, children, about the physiology of the menstruation, about the products which are available, which can be used during menstruation, and about pain management, which girls are very much concerned about. We should try to remove the stigma and shame. I'm sure all IMA branches will support this task of red revolution. We can call it as red revolution very successfully. We can take this topic in even for community awareness during our teen talk series. Really, I am very much thankful and grateful to you all for attending this webinar. I am very much thankful to organizers. IMA Aurangabad team MPH. I am very much thankful to all the speakers. Thank you very much. Let's. This is just a beginning of teen care series. For doctors. Let's continue it during next few months. We will take certain topics which are very important for management of adolescents for the doctors, and we will continue it. Thank you very much, everyone.
थैंक यू ज्योति मैम. तो पिक्चर अभी बाकी है ऐसा आपको बोलना है.
Yes.
Yeah. So there is one question. Actually, it is from a non-medico lady. मैम मेरी बेटी को भी पीरियड्स इरेगुलर रहते हैं और जब पीरियड्स आते हैं तो उस टाइम में स्टमक एक बहुत होता है, तो उसके लिए क्या करना चाहिए? वैजयंती मैम, कैन यू टेक द क्वेश्चन?
Sure. Am I audible?
Yes, yeah. Yes.
How old is her daughter?
She is not written, ma'am. Maybe 12-13 years. Just started the periods.
Just started with the periods.
Yeah.
As I mentioned in my talk, the periods are bound to be irregular in first few cycles after onset of menarche. If she's too much disturbed because of her pain, then you can give her a tablet called as Menstrual spas. Okay, if she doesn't have any other medical condition like asthma or any other major disease for which she's taking any treatment, so best is to consult your doctor. Let the examination be done so that whether she's anemic, whether any other cause is there. If there is no cause, then if it's only because of the hormonal changes, then simple tablets like Menstrual spas and all will take care of her symptoms. Along with that, please encourage her to have a fresh air walk during the evenings and all. Maybe you accompany her, and then you can talk to her about other things. Okay, sure. Indulge her into, many a times we see that the most of the young girls are continuously on their mobiles, or some laptops. So these type of baithya goshti apan jala manto na lifestyle, that is another reason. So for having stress element indulge into them, so ask her to get engaged into some activity ज्याच्यामध्ये त्याला creative mind तिचा तिला वापरता येईल. So these things should help her. थोडंसं ओटी पोटावरती कोमट पाण्याने शेकणं किंवा हॉट वॉटर फर्मेंटेशन आणि शेक देणं वगैरे या गोष्टी पण उपयोगी पडतात. सो दिस शुड टेक केअर ऑफ हर. बट मेन तिच्याशी बोला की ठीक आहे, हे सगळ्याच मुलींना होतं तुझ्यासारखा त्रास, हे पण महत्वाचं असतं.
बरोबर आहे मॅडम. थँक्यू सो मच. वन मोर थिंग इज दॅट डज दिस antispasmodics affect the flow of menses? One doctor has asked. When we give antispasmodics for dysmenorrhea, does it affect the flow of menses?
No, it doesn't. It doesn't.
Okay.
It doesn't affect any flow. It doesn't have any. In fact, for excessive bleeding also we recommend this, no doubt. But if it's a normal flow, it will not get reduced because of the antispasmodic. The spasm, how do I explain, is partly because of the local prostaglandin release, So because of that, at the level of cervix, so because of that, the pain element is there, and that is why we are just anti-prostaglandin. So that is the rule of Mepinam, we can say.
Okay, ma'am. Thank you. Dr. Ritu, ma'am, a question for you about the menstrual cup that you have shown. From which age the child can use it?
Right in the younger age, before marriage itself, they can use the smaller cup. But the younger girls who are not married, they feel it difficult to insert in the vagina. So post-marriage is not, yes, but it is recommended for young girls as well. The smaller size cup is.
So what do you suggest? Which age group do you suggest from?
Right from 14.
14 years and above. Okay. And about the new sanitary napkins, there is one mother asking that it causes some irritation to the girl for a few days. So what is the problem? Some chemicals are used in it or like that?
some of them use a synthetic cloth. Like I won't recommend any brand or not promoting. But Whisper is synthetic one. While the purple colored Stay Free is a cotton one, which is really very less irritable. So usually we recommend that when the cotton pads.
Yeah, because most of the patient comes to us with the after the periods, they get a dermatitis like situation in the perianal region, perineal region. Yeah.
So the recommendation is thin pads, cotton pads, which is to be changed every 4 to 6 hours, and with a loose cotton garments as well.
Okay. Can I add one more point to what Madam said?
Sure.
Generally, the infection, why does the infection occur? Many times, still in many of the families, taking bath during the normal bath during menses is also not allowed on the cultural grounds also. So these are the reasons more than the quality of the sanitary pads, So we need to educate them about the menstrual hygiene. Like they need to, even after like every time they visit the washroom and all, it's better to, as a general hygienic precaution, simple water to clean the perineum and the local area is important, and change the pad frequently. These are the two things which help the girls getting rid of this type of rashes and issues related to local infection and irritation.
Okay. Dr. Neeti, are you there? Dr. Neeti Soni? There's a question for you. Whether the nutrition is really important in the pubertal spurt?
Nutrition is of utmost importance throughout the pubertal age and even later on. As already mentioned, the folic acid and iron. These two supplements are very important. Along with it, a big amount of calcium is also needed. Lots of the problems of menstrual problems like dysmenorrhea and all the other related menstrual problems can be nicely corrected with a healthy diet and healthy lifestyles. So yes, nutrition plays a very important role.
Okay, thank you so much. So almost we have covered all the questions from the YouTube also. So now we come to the end of this session. So I would request our convener, MPH Aurangabad, Dr. Aparna Raul, to please give the vote of thanks. Over to you, Aparna.
Thank you. Yeah, thank you, Dr. Renu. I, Dr. Aparna Raul, as Secretary of Aurangabad PH body, I feel very proud of being a co-host to this first Talk Teen series, that is Red Revolution as correctly termed session. And I thank state authorities and office bearers, especially Dr. Suhas Pingre sir, Dr. Ravindra Kutte sir, and Dr. Patte sir for giving MPH body Aurangabad a chance to host this program. I thank state organizer Dr. Jyoti Chitpukar Madam, Chairperson, MPH IMA Maharashtra State, and Dr. Neeta Biyani Ma'am, Secretary, IMA MPH Maharashtra State, for their constant efforts to make this Zoom meeting a success. I thank moderators of today's session, Dr. Renu Boralkar Ma'am, Chairperson, MPH IMA Aurangabad, and Dr. Archana Bhandekar, Convener, MPH IMA Maharashtra State. I also thank all speakers, Dr. Neeti Soni, Dr. Ritu Balani, Dr. Vajanti Patwardhan, and Dr. Jayashree Shikhar for their excellent talks on their respective subjects. I thank all hosts, Dr. Sachin Farnis, President IMA Aurangabad, Dr. Ujjwala Dahifade Ma'am, Honorary Secretary IMA Aurangabad, and Dr. Vaishali Kulkarni, Co-Chairperson of MPH IMA body. I thank all the doctors, seniors, and all audience for joining and listening to these talks. I also thank all digital team, Bodhankar Events, and IMA staff, especially Shankar and Amol, for their helping hand at ground level. I thank you all. Thank you. Let's conclude this meeting. We hope to meet in future with continuing this series of sessions.
Yeah, sure. We will look forward to it. And to Jyoti ma'am, we really thank you to give us this platform to conduct the first of the series. And
Thank
many
you, madam.
more best wishes to you. Yes, Ujjwala, do you want to speak?
No, I was saying thank you so much.
Yeah.
Thank you, everyone.
Yeah.
Renu, you are conducted very nicely.
Thank
Archana, with Archana also.
Yeah, Archana, काहीतरी नेट प्रॉब्लेम झाला काय माहिती नाही.
And
yeah.
Hi, Renu.
Ha, Ujjwala, please have your concluding remarks, please.
It is an excellent presentation. All speakers were extraordinary, as if like we are in a conference.
Yeah.
Up to that level, we did the and Jyoti.
Yeah.
Yes, it was a really excellent program.
Thank you.
Yes, and
It's
hence
just because of IMA Aurangabad and
no, it's not. You
and
are
of course our eminent speakers.
yes, all eminent speakers, and everything was very smooth.
Yes.
And on the contrary, our president and secretary, they join also for yes, opening remark.
Yeah.
Thank you. And henceforth, we will do. You can suggest, or Renu is an enthusiastic girl. And even our Mission Pink Health team is very good.
It is a teamwork. Yeah, we all, and you are also promoting everything and encouraging us.
Renu madam, thank you for giving me this opportunity.
Are welcome, ma'am. You all are welcome. You are so much great speakers, and we have learned so much from you today.
Thank you.
Especially Ritu ma'am's presentation. Without presentation, she gave her the simple things that she has shown. It was helpful to many of us. Yeah.
तू कुठे बीचवर आहे का?
मी नाही, मी मागे असं व्ह्यू लावलेला आहे, गोव्याला बसली आहे मी.
नाही मी तेच म्हणते, ही एकदम गोव्यात बसली आहे.
And Vaijayanti ma'am, you are so much vast topic. You have covered it very nicely. And even Niti, puberty related issues, you have covered very nicely. All the physiology and everything.
You're part of this very important.
And Jaya madam च तर काही विचारू नका. She is a best psychologist. So in our adolescence academy, she is a very good psychologist and adolescent pediatrician.
But good to talk on different platform and meet different people, no?
Yeah. Yes, you can stop live. Yeah, you can stop live.
Okay.
Now you can.
Thank you, girls.